To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, and welcome to Your Health. Today we're going to talk about hospice philosophy because I'm joined by Elisa Gerke from Unity Hospice. Hi, Elisa.
Good morning.
Well, maybe we should just jump in. What are some misconceptions that people have around hospice?
Yes, probably the biggest misconception is that hospice is a place, and hospice is a form of care. It doesn't matter if somebody lives in their home, if they're residing in the hospital, in a nursing home. It's all about our interdisciplinary team, our docs, our nurses, our social workers, our chaplains, our volunteers, helping that patient and family formulate the plan of care. What is it that matters most to them? And then rendering that care to help them get through and beyond end of life.
And hospice has so many benefits for the patient, but also the family. But the one thing people ask a lot, is that expensive?
Great question. Many insurance companies cover hospice, Medicaid, Medicare, and we also have an awesome community that supports our community care dollars, which are designed to ensure that anybody, regardless of their financial status, can be in receipt of hospice services. So that is the very last thing that anybody has to worry about, is any financial burden as a result of receiving hospice care.
Yeah, I love that, and it's such a respect for the patient to have that.
Absolutely.
All right, so tough stuff. We're maybe going through this. What advice would you give to families who may be on that journey?
Sure. Have a conversation with your physician. Help get some guidance, and place a call to Unity. The call does not have to come from the doctor. Anybody can place a call and ask questions and have a referral. We can help you navigate getting an individual into hospice earlier. There's so many benefits for the patient and family. Too often we see that patients are referred really late in their disease process, and their time with us is very, very short.
And that's a real shame to do that.
It definitely is.
So the biggest and maybe the toughest question is, if we see a loved one, how do we start that conversation with them?
There's no doubt that's tough. Start young, start early. I'm 58. My husband and I have our advanced directives in place. We've talked about what we do and don't want, so that burden doesn't exist at the point that it needs to be executed. So having that conversation early on and getting it documented will definitely help ease the pain and the difficulty when that vulnerable time does come.
Well, and also it makes it just less chaotic, less stressful, because you know the wishes. It's right there. It's easy.
Absolutely.
All right. Well, Elisa Gerke from Unity, thank you so much for being here and walking us through hospice.
Thank you.
And we want to thank you for watching To Your Health.
The preceding was a paid advertisement.